Hi, I'm Dr. Nagendra Sardeshpande, gynecological endoscopic surgeon. So I had this patient coming to my clinic about a few days ago, 50 years of age, and she had abnormal bleeding on and off since the past few years. She had taken some form of medical treatment or the other over that period of time. And when I examined her, she had a uterus which was almost about 4 months to 5 months of pregnancy size because of a huge fibroid which had grown to that size over a period of time. So I explained to her that, madam, your medical treatment that you have tried over the few years has not worked or probably has reached its end point, and now we have to reconsider a definitive form of surgery, and at this age it's usually removal of the uterus. She asked me many questions. I answered most of them. Then I advised a certain blood test which she requires to undergo before undergoing a surgery. She went out, sat for some time. Then she came back and said, "Doctor, I still am not comfortable with doing a surgery. Don't I have a choice? Can we not try medical treatment once again?" So then I realized, that there are two parties here trying to make choices. In all medical treatment, there are two parties. One is I myself as a doctor, or whoever is there, the treating person. I have to make certain choices. This treatment, that treatment, surgery, no surgery. And on the opposite side is the patient, who also has many doubts, many questions in their mind, also would like to avoid surgery. Naturally, all of us would like to avoid surgery if possible, and would like to make our choices, whether medical treatment, some form of conservative surgical treatment, or a definitive surgery. And sometimes even there's a third party, a relative sitting beside a husband or somebody, some sister, who also would like to intervene and try to make some choice for the patient in case he or she is undecided. Sometimes those choices match, sometimes they clash with each other, and then somebody has to compromise somewhere and try to help come at a final solution. So that's the interesting part of medicine in today's age, especially. Maybe 50 years ago, we didn't have much medical treatment. Most of it was surgery in gynecological situations. And but today things have changed. There are treatments or options available. Of course, in this case, again, whatever options she may have thought, she may have Googled, I would still have insisted that hysterectomy is the best choice. But sometimes in borderline situations where you have just a little bigger uterus size, I could have tried some form of medical treatment till she reached the age of menopause. So I think a learning lesson is that all patients require to be given options. They expect that. They expect that they make the choice of their treatment. It's a normal human psychology that you are in control of your body, you are in control of your situation. Second is that give that patient space and time. Let the patient discuss, let the patient ask questions before we arrive at a final solution to her problem. Life is all about making choices right from the day we are born. At every moment, every minute, every second is about making decisions. Do this, do that, don't do this, don't do that. It's always like that.